Good morning, everyone. Today we are going to talk about Aboriginal community-controlled health services targeting cardiovascular disease in the Aboriginal and Torres Strait Islander population in a regional area of New South Wales. Our group has 4 members. Yuhan, I'm going to talk about aims and objectives, following by Nifi, who is going to present Aboriginal and Torres Strait Islander healthcare context. Then it's Jinxin. He is going to introduce access to Aboriginal community-controlled health services. And finally, we have she is going to discuss healthcare issue of cardiovascular disease in remote area. Before we started, we have a video to show you guys about an Aboriginal and Torres Strait Islander man who's called Nicky, talk about his experience of the cardiovascular disease.
Probably go back to 1997 when my father died of a heart attack in September 26th. The day before the grand final in 1997, we played Adelaide Crows the 27th and lost my dad through a heart attack. In September 2nd, 2012, I experienced the same situation with my chest pains and did not know what the symptoms were, but thought that it was just indigestion, heartburn, and just a glass of milk and had a quickies and it'll go away. Yeah, it sort of knocked me around a bit. I was scared, didn't know what else to do. With the heart attack situation, you think you just get out of bed and everything's all normal. But to my shock, I had to learn to walk again. My heart was just saying, Nicky, you're 52 years old now. There's others out there that you can reach while you still can to get a message across to the Indigenous people that you've known and you loved for many years. That please don't be scared to consult your doctor. If you do experience chest pains, tingling in the arms, jaw bones, please ring 000.
Again, one of the key messages I think which is really important is to think about quitting smoking, get some support to do that, set a date and a time that you want to do that and really work towards it. And again, if you don't succeed the first time, try again. It's really important. And as Nicky says, it makes a big difference to him and it'll make a big difference to you. And we really hope it'll make a significant difference to the Indigenous community.
Well, shake your hand and say, this is a guy. This is Tony Stubbs. This is the guy that I met 5 months ago. Over the Secular supporter. Works at the Heart Foundation. Great man.
I can say it all the time, and we're quite committed at the Heart Foundation to reducing the gap in Indigenous heart health. But with someone like Nicky who can tell his story with integrity and being genuine about it, it means a hell of a lot to the Heart Foundation, and hopefully we can make a difference in the Indigenous community of Australia.
I support the Heart Foundation in closing the gap.
After the video of the Heart Foundation and Nicky's story, we know lots of Aboriginal and Torres Strait Islander people doesn't notice that they have a cardiovascular disease. According to Health Inform Night 2017, Aboriginal and Torres Strait Islander people are 3 times more likely to have a heart attack and are dying from cardiovascular disease at almost twice the rate of non-Indigenous people in Australia. Here is the map, which shows the mortality rate of cardiovascular disease in different areas in Australia. We can see from the picture, the Northern Territory has the highest mortality rate, which is in red color, and Queensland, which in pink color, is the second one. Both of these areas have the large population of Aboriginal and Torres Strait Islander people, so that the mortality rate is very high in that areas. And culture also can be a significant part of influence Aboriginal and Torres Strait Islanders people's health. All of us know that when British came to the Australia, they changed the Aboriginal and Torres Strait Islanders people's life, such as the Stolen Generation. The link between culture and Aboriginal and Torres Strait Islander people's health can be, according to the Heart Foundation, Aboriginal and Torres Strait Islander suffers poor experience and feel uncomfortable when they're going to see the doctors. One of the reasons caused this situation can be racism, discrimination from other peoples, also the policy, which called one size fits all. The policy, which means we should consider appropriate method and care plan for Aboriginal and Torres Strait Islander people to show the equality of access healthcare system. Furthermore, Australian Indigenous Health Informed Night 2013 says that psychosocial problems also consider being great risk factor for Aboriginal and Torres Strait Islander people, such as the impact of the stolen generation and removal of children, separation from culture and identity issue, and economy and social disadvantages. As we all know, that there still has a big gap of health issue between Aboriginal and Torres Strait Islander people and non-Indigenous people. Why does this happen? One of the reasons can be lack of equal access to health. Aboriginal and Torres Strait Islander people have less routes and less healthcare services compared to non-Indigenous people. Moreover, social economic gradient shows that people with higher income have better health compared to people who have lower income. There is a project held by Heart Foundation called Let Health, which aims to close the health gap and deliver the federally funded project to improve the integration of health services and care coordination by strengthening relationships between hospital, local Aboriginal community-controlled organization, and primary health network. Compared to non-Indigenous people, Aboriginal and Torres Strait Islanders people have a lower standard of health infrastructure, such as safe house, healthy food, clean and safe drinking water, and rubbish collective system. To work as a health professional, what we should think when we're caring Aboriginal and Torres Strait Islander people. For instance, nurses should understanding and respect Aboriginal and Torres Strait Islander people's culture, deliver safe nursing care, and set proper nursing care plan especially fit for Aboriginal and Torres Strait Islander people's culture. Educate them as a health professional to let them have more knowledge about in which way can be healthier and happier in their life, and how could they have a healthy lifestyle of the Aboriginal and Torres Strait Islander people. So that's all for my information. Next, we have Nivi to talk about Aboriginal and Torres Strait Islander people healthcare context. Thanks for your listening.
Hello, good morning. My name is Nifei. I'm going to introduce something about health context of the indigenous community in remoteness. Okay, let's get it started. Here we have a definition of the remote. A remote is a faraway place, distant in place, space, time, and connection to other populations. Okay, the community background formation in remote area, which is distant from city center. They have large population. As we can see from the chart, 21% of indigenous people lives in remote or very remote areas, compared with 1.7% of non-indigenous population. and inconvenient transportation as well. Roads are usually long, dusty, and unsealed, even if a 100-kilometer trip would take several hours. The distance and inconvenient transportation make the Aboriginal communities lack access to healthcare services. As a result, the mortality rate for Indigenous people is 70% higher than the non-Indigenous population. The life expectancy for Aboriginal community is lower than the non-Indigenous community for 10.6 years. So let's see what kinds of healthcare services is available for Aboriginal community. So first one is the pharmaceutical benefit scheme. It's useful for Indigenous people to get a GP or take a test for free. The next one is closing the gap for pharmaceutical benefit scheme prescriptions. It helps Aboriginal people to get most prescription medications at a lower price or free of charge if they have a healthcare card. Aboriginal and Torres Strait Islander health checks. It helps Indigenous people to check chronic disease, such as asthma, cancer, heart disease, and diabetes. It benefits Indigenous people to identify chronic disease and treat them earlier. Next one is the Medicare liaison offices, which is an organization that provide Medicare education, training healthcare staff for giving Indigenous population health plans to make sure that Indigenous people can access to healthcare services. And if the Indigenous population need assistance to access to healthcare in private, here is the Aboriginal and Torres Strait Islander access line, where the people can get support. Okay, that's all for me today. Thank you for your listening. Next, Jinxin is gonna talk about how to access to Aboriginal community controlled health services.
Hello everyone, I'm Jinxin, and now I will talk about Aboriginal community controlled health services and explain how important to Aboriginal people in remote or very remote area. First, I'm going to give you the definition of Aboriginal community controlled health services is that providing holistic and comprehensive primary health care services to Aboriginal people who has first interaction with healthcare services. Why this healthcare need is significant for individual or communities. According to Heart Foundation, over 20% of Aboriginal people living in remote area. From the research, they are higher risk in remote area for getting cardiovascular disease than other areas. From this situation, ACCHS starts the study of managing cardiovascular mortality to control the conditions of the cardiovascular disease of Aboriginal people. ACCHS have three majority of methods to impact on the individuals and the communities of Aboriginal people. According to Aboriginal Health and Medical Research Council, they educate Aboriginal people how to reduce the risk of cardiovascular disease. The reason is that most of Aboriginal people have unhealthy lifestyle, such as smoking, unbalanced diets, and the lack of exercise. This unhealthy lifestyle can cause chronic disease, such as hypertension, diabetes, and obesity, which are factors that causing cardiovascular disease. ACCHS improve health outcomes of primary health care of Aboriginal people to ensure they can receive quality healthcare services. It also established cardiac prevention and rehabilitation program to control the mobility and the mortality of Aboriginal people. From current healthcare policies and practice, Aboriginal people who are living in the remote area with cardiovascular disease can receive the benefits. According to Nursing and Midwifery Board of Australia, nurse practice in safe and competent manner and respect dignity, culture, ethnicity, values, and beliefs of people receiving care. In the last, Shu will let you know about cardiovascular disease in Aboriginal and Torres Strait Island people.
Hello everyone, my name is Xu. I'm going to talk about cardiovascular disease in Aboriginal and Torres Strait Islander people. Let's have a look at these cardiovascular health statistics. 13% of indigenous affected by cardiovascular disease in the 2012 to 2013 Australia Aboriginal and Torres Strait Islander Health Survey. And people living in remote areas are higher risk to having cardiovascular disease. 14% of total deaths in indigenous by heart disease in 2015. Cardiovascular disease was the third biggest contributor to total disease burden, that causing 12% of total burden in Aboriginal and Torres Strait Islander people. Therefore, cardiovascular disease having a significant effect in indigenous health. Let's see cardiovascular disease impact on community and psychosocial of indigenous people. For the environmental health associated with social determinants, the remote area people lack to access to primary health care. So this is a barrier for them to approach to health care service. They living in overcrowded house, poor environmental health, and low water quality links to cardiovascular disease. Cardiovascular health is also affected by lifestyle. Some significant risk factors impact on their social emotional well-being. It is important to having comprehensive primary care service, such as providing help with income support, drug and alcohol service, and healthy promotional service. Healthy professionals should consider social determinants associated with cardiovascular disease and providing culturally secure care to the Aboriginal and the Torres Strait Islander people to understand the cardiovascular disease causation to provide a holistic nursing care. Nurses need to keep update themselves by continuing professional development to be culturally competency. In conclusion, the major problems are unacceptable health gaps between Aboriginal and the Torres Strait Islander people and no indigenous people, lack of healthy care service and healthy care infrastructure and social emotional well-being of economic and social disadvantage, substance misuse, and physical health problem. The solutions has been supplied by providing more federally funded, educated the Aboriginal and Torres Strait Islander people, and make proper healthy care plan fits for indigenous people, as well as consider social determinants, culturally competent, and safety nursing practice. Nurses need keep updating themselves by continuing professional development. This is our presentation. Thank you for your listening.